Okay, we left off here at the end of the last video and we talked about that the vocabulary of movement for synovial joints is going to be presented in pairs with opposite or contrasting meanings. It's also important to brush up on your anatomical planes and directional terms, so medial, lateral, anterior, posterior, and the planes in which the movement is focused on. So that's going to be important. I'm going to make you a Quizlet of the ones that I for sure want you to memorize of these movements, and realize that each of these movements is coming from or going back to zero position. So zero position is the position of the joint when the person is in standard anatomical position. Remember, that's standing erect, face forward, feet are shoulder width apart, and your arms are down, except that your thumbs are pointing laterally. So that's the only kind of weird positioning there. So the joint movements are described from deviating from zero position or returning back to zero position. So your first pair of movements is flexion and extension. Flexion is a movement that decreases the joint angle. We see this commonly in hinge joints, and an extension is straightening the joint and generally returns the body part to zero position. Hyperextension, remember hyper always means more, so hyperextension is the further extension of a joint beyond or past zero position. We can see this in a few joints, not all of them, but flexion and extension occur at nearly all synovial joints. And then hyperextension we see in just a few, such as here's hyperextension of the arm, going past that back to zero position. Okay, your next pair of movements are abduction and adduction. Abduction is the movement in the frontal plane away from the midline of the body, and then adduction is in the frontal plane back toward the midline. And then that gives you hyper abduction would be if you raise the arm over, back, or in front of your head. And then hyperadduction would be crossing your fingers or crossing your ankles. Elevation and depression, movement that raises the body vertically in the frontal plane. These are easy to memorize. Depression is lowering the body part in the same plane. Protraction and retraction. Protraction is the anterior movement of the body in the horizontal plane, and then retraction is the posterior movement. Those are also pretty easy to remember. Circumduction is at the end of an appendage. One end remains stationary while the other end makes a circular motion. It's technically a sequence of flexion, abduction, extension, and adduction movements, but those combined in this specific example is called circumduction. Okay, we can rotate a bone spinning on its longitudinal axis, and that's called rotation. So this shows the thigh or the head or the arm, and we can also rotate our trunk. A medial rotation turns the bone inwards, whereas lateral rotation turns the bone outward. Okay, supination and pronation is forearm movements. We can see them in other body parts, but it's primarily forearm movements. So supination is the forearm movement where it turns the palm to face anterior or upward. And in anatomical position, the forearm is supinated. The radius is parallel to the ulna. And then the opposite of that movement is pronation, so turning the palm posterior or downward is the opposite. Okay, and then we have movements of the head and trunk. We can see flexion, hyperextension, and lateral flexion of the vertebral column, and there's an example of each one. We can also rotate our head and our trunk. That's pretty obvious. Okay, we do have some special movements just that we see in the mandible, and they're called lateral and medial excursion. Lateral excursion is right or left movement from the zero position. Medial is movement back to the middle. And we also see protraction, retraction, elevation, and depression when we are chewing. Okay, then this long list is special movements of the hands or digits, and these are all words that you have seen before, but except for opposition and reposition. So the other ones are just specifically of the hand or of the fingers. But let's jump down to opposition. That's moving the thumb to touch the tips of any of the fingers. And then reposition is returning the thumb to zero position. And then special movements of the foot. Again, the first two you've seen, but inversion and eversion are special of the foot. Inversion is the movement where the sole is turned medially, and then eversion is the opposite of that, where the sole is turned laterally. Okay, I just wanted to make sure. The rest of these, we are going to have one more video, but you'll notice in this last video that I'm going to jump around a lot. This talks about specific joints, and I'm going to let you focus on the joints that you have ability to focus on in the lab. So we're not going to go through all of the joints that are listed in this PowerPoint. We're just going to focus on a few.